Hey there, Triangle Health Center. Here's your Heart Talk preview. I can't wait for March 14th, my favorite, honestly for me, workshop of the year. I put a lot of effort into real heart health, not controlling heart sickness, heart disease. You can't manage disease. You have to manage health. And that's what we're focused on, to keep your heart healthy. And so we're really dialing in because so many people that come into this office are taking all of these. This is just one lady's, this is her cholesterol drugs, this is her blood pressure medication, and another medication for blood pressure. So many people are piling these medications into their body. A lot of people very unnecessarily, very recklessly, without having any knowledge of what their status of the health of their heart is. They quickly jump to controlling a disease because you're a little bit outside of what normal is said to be. We got to break through that mode because a lot of people are unnecessarily drugging themselves, which is toxic and harms you in the long run. I'm not telling you to throw out all your medications, but we have a lot of people that come off cholesterol and blood pressure medications. So then you start looking at alternatives for these medications, and people will constantly bring in or want to know about omegas. And I recommend omegas for almost everybody, but here's a brand I see a lot of people taking, and inside it, it contains glycerin, which is sugar. Ethyl vanilla is also a form of sugar. Sorbitol is a sugar alcohol, and gelatin. So it has 4 different forms of sugar in it. Now this is better than actually most that I see. It's a very low dose though. One serving of this one gel capsule will get you about 200 omega-3s. To compare that to the one I normally recommend, is one capsule will get you 1,200 omega-3s. So a lot of people are wasting their money and not getting what they could get out of it, and they're getting a lot of unnecessary fillers. Speaking of, another topic we're going to be touching on, calcium. Gosh, this is overprescribed. So many people taking calcium. Equate might as well be a drug, anything that they make, by the way. And that's the first problem that's wrong. But calcium, people are pouring calcium into their body. You are calcifying your arteries because you're taking too much. How much calcium and milk does a cow eat? None. Why? Because they eat grass. They eat things that come and allow your body to synthesize calcium. Your issue is not calcium. Your issue is minerals. We're going to break through that, and we're going to show you the guidelines of if you're taking too much calcium, are you putting yourself at risk? We will break down those barriers and those walls, break down supplements like this and why so many of them end up in the drug bin. I can't wait. March 14th, if you're not signed up today, please do it right now. There is a purple sheet in the sign-up bay. Get your name on here. We're going to send you a ticket. There's no charge to do it, but I tell you what, it'll be a standing room only event, and it should be, because too many people are suffering unnecessarily when it comes to their heart. We're doing something about it. Heart Talk, March 14th. Sign up today.